more minutes with a little bit of information about public comments. Two different avenues for members to provide public comments. Submit a comment from the link on our HSSN webpage. To make a request for a comment during our meeting, direct messages to Lindsay, and you can see Lindsay in the Zoom chat there, by 8:45 a.m. Include a quick topic description and the organization you represent. The first two requests received will be provided an opportunity to speak for 2 minutes. Additional comments can be submitted through the online public comment link. So if you've got comments, the link's provided there, or you can message Lindsay directly. And we'll have time for that till 8:45. And in the meantime, I'm going to hand it off to Katie for a program update. Katie Gentry.
Thanks, Adam. Hi, all. Katie Gentry. Y'all can hear me, I hope. Great. My name is Katie. I work at Washington County. I'm the homeless programs manager. A few quick updates from Washington County. Currently, we have pod RFP out on the in the ether in our procurement portal, open for folks who are interested in applying for running a permanent pod site, 60 pods at one location. Currently, we have 2 pod sites at Cornelius and Aloha, and we're looking to bring those together in one site, 60 pods. That closes on November 18th. So if folks are interested, November 13th, not the 18th. I totally told you that wrong. If you are interested, check out the procurement portal. Also happy to drop that link in the chat. The next big exciting update I have for folks is we are opening our Hillsborough shelter in partnership with Project Homeless Connect, and they are hosting an open house. It will be Monday, November 17th from 2 to 6 p.m. at the location. Also happy to drop that address in the chat. We would love to see friendly faces, come meet staff, see the shelter. We will start moving folks in towards the end of November and early December. As a reminder, this isn't new capacity, but rather replacing the capacity that we have, and we'll be shutting down temporary shelters that we have open. But really excited to have a brand new building, and it is beautiful. If you haven't seen it or driven past it, that construction has been awesome right by the Winco in Hillsborough. Other big update from me is that our wait list is currently opening for the Housing Authority. So this is all of our project-based wait lists and all of our public housing. We are moving to one wait list rather than having individual wait lists for all of our different public housing and project-based vouchers that we have throughout the county. The unique thing about this, it's open from yesterday through Monday at 5 p.m. Would highly encourage folks to apply. It is targeted specifically at folks 30% and under AMI, but up to 50% can apply. Thanks, Lindsay, for dropping that link in the chat. That is we're going to be closing it Monday. Everybody who applies will be randomized and added to the wait list, and then we will open it again permanently in January for folks to add to the wait list. But we do have quite a few projects through that, over 800 units that are supported through that wait list. And we did a unique thing this year with the wait list is there are now 4 zones that folks can apply in, so they can be more targeted in where they want to apply. So Forest Grove, Cornelius, Hillsborough, Beaverton, north of 26 area, and then kind of the southeast section of the county being Tigard, King City, that area. So folks can apply for one zone, all 4 zones, some combination of the 2, and that's where we will start to pull folks in as units come available, and really excited about that. If folks need support, they can come into the Washington County Housing Department office between 8:30 and 5. We have folks there to help support, as well as a phone line that folks can support, as well as check out the FAQ online. A lot of great questions and answers, but would really encourage folks to apply. The last big update I have is we are hosting a public hearing for our local implementation plan changes. So if you don't know, we had a 10-year local implementation plan at the start of the supportive housing and services tax. That local implementation plan was talking about the system prior to SHS and looks very different now. So things like we wanted to open 250 units of shelter. We now sustain 385. So we're moving into kind of a next next phase and an update to that local implementation plan, and really excited about that work. But we're hosting a public hearing for folks to give feedback and really lend their voices to the work being done. That will be Thursday, November 20th from 5 to 6 p.m. Here at the Public Services Building, which is right across the street from the Housing Services. It's where Sips and Savings is if you need a caffeine fix. And it will be in the boardroom where the Board of Supervisors meet. So if folks have questions, feel free to drop them in the chat. I will stick around for a bit and drop any links that staff on this call didn't already drop in. Thanks, team.
All right. Katie, thanks for the time. Lots of exciting things happen and important dates to remember. Okay, we're going to move into our presentation portion, and the first presentation we're going to be hearing from is regarding to HMIS data presentation. And I believe I saw Heather on the call. Heather, are you all set and ready to go?
Yes, I am. All right. Well, I guess I need to share my presentation, so I'm not quite ready. But while I'm trying to get my presentation up so I can share it with everyone, I'll do a quick introduction. So my name is Heather Scriver. I use she, her pronouns, and I am the Data and Evaluation Supervisor here at Washington County. And what I am here to talk about today is a data presentation, but I think specifically the request was to go over our point in time count and our housing inventory chart. Okay. And so with that, I'm going to go over those two. First, I'll start with the point in time overview and then some of the highlights from that data. Then I'll go into the housing inventory chart, kind of what is it, and also going into some highlights. And then I'm going to have I have one other chart with some additional homeless services outcome highlights from our annual data, just to kind of bridge a little bit of where we are. So starting with the point in time count. So the point in time count is an annual HUD required count of homeless individuals in our community. For the data that I'm presenting, it's going to be a snapshot of homelessness in our community as of January 23rd, 2025. A little bit of context around what is in the street or in the point in time count. There's two components. The first is a shelter count, and that is required by HUD every single year. So that's just a survey of our HMIS data, who was in shelter on the night of January 23rd. We do a lot of validation with our providers to make sure that this was an accurate representation of who was in their shelter that night. And then the second component is the street count, or sometimes called the unsheltered count. That is required by HUD every 2 years. Historically in Washington County, we still did it every year until 2023, when we began doing a regional point in time count. And that is when we switched to doing it every other year to be consistent with Multnomah and Clackamas, and that way we could regionalize it. It is a lot of effort to go through a regional point in time count, but there's a lot of benefits to it. So it's a way to kind of counterbalance that. One thing with it being regional, we were able to deduplicate the data on a regional level. So we know that everyone who is counted in our point in time count, at least for the data that we have available, we feel confident that they were not also captured in another county. But there are some, challenges with the street count. Volunteers, they go out into our community and they collect survey information, but participation in the survey is considered voluntary, and we often have incomplete information, so we can't always match people up. But we do our best. We attempt to match each person in the street count with HMIS to ensure that deduplication. And this is probably one of the most popular HUD reports. It's used nationally to understand and compare homelessness across the nation, and it's included in reports to Congress. So what did our street count show us, or our point in time count show us this year? The biggest outcome, or the biggest takeaway, is that homelessness is rising in our county. That is an unfortunate reality. So you can see that it looks like there's a dip in 2024 in our overall point in time count. That is the top bright blue line. That's the total. But that is because we didn't have a street count in 2024. So that was just the sheltered count. But you can see that even 2023 compared to 2025, we saw a very significant increase. One thing that we can see is that our total unsheltered or street count, which is the light blue line, that's actually stayed relatively stable since 2022. We've actually had a pretty consistent number of people popping up into our street count. But what we've seen is that most of the increase comes in our sheltered count, and that has to do with the great expansion of shelter capacity. So as Katie was talking, we used to have a goal to have 250. Now we're sustaining 385 units. That means households that we can serve, and that means an even greater number of people. So that's the one highlight, is that homelessness is growing, but more people are being sheltered, at least while they're going through that. The other thing that I'll flag is this bottom kind of golden brown line is the total number of people who met the HUD chronically homeless definition. Unfortunately, we are seeing that increase. It's increased pretty significantly from 2023 to 2025. And I'm going to pull in one of our other HUD reports, which is called the System Performance Measures, or SPMs. The fact that homelessness is growing is actually really consistent with what we're seeing in one of the system performance metrics called the first time homeless metric. What you can see in this graph is that brighter blue is the people who are recorded as experiencing homelessness for the first time, which is measured by not having any prior system entries in the 2 years prior to the year that they're getting counted in for this metric. And then the darker blue is people with prior experience of homelessness. And what we can see over time is that that brighter blue bar has been growing. It did shrink back a little bit in our most recent system performance measure, so it'll be interesting to see how that grows. But this is a very consistent story. And the next call out that I want to make is we are making a lot of progress housing people. So this growth in homelessness is not due to us not being able to house people. It's really due to an increase in demand. So this chart that I'm showing is looking at that 387, well, I guess it's slightly different because we couldn't find HMIS IDs for everyone, but of those who we could find an HMIS ID, out of those 387 chronically homeless, it ended up being a little bit less than 300 that we could actually evaluate. But we looked to see where were they in the prior to point in time counts. Where did we capture them in a previous point in time count, or were they new? And what you can find is that the vast majority of the people who are flagged as chronically homeless in this year's point in time count were new. This is the first time we've seen them in a point in time count. And so that just kind of grows to show how this situation is growing. Another way to view it, this to kind of reiterate that we are making progress housing people, is this chart. So this chart on the left-hand side, what we are looking at is the people who were chronically homeless in either the 2023 count or in the 2024 count. And then we look to see where they are as of January 23rd, 2025. Are they still homeless, or have they been housed? And what you can see here is that most of them, I think it was around somewhere between 65 and 70%, were actually housed or had some other resolution of their homelessness situation. So we're making a lot of progress. People are moving through our system, and the need is growing. All right, so now I'm going to move on to our housing inventory chart. The housing inventory chart is kind of paired in a way with the point in time count. It's similar that it captures a point in time snapshot, but this time it's looking at our capacity and utilization of all of our shelter and housing programs. And it's a snapshot as of the same night as the point in time count. So as of January 23rd, we're looking at, okay, how many homeless individuals do we have? And then also what's our capacity to serve those individuals? Because it is a inventory and utilization, it doesn't include things like prevention that doesn't have a set inventory, coordinated entry, street outreach, those types of programs. It's really focused on shelter, transitional housing, and housing programs. And utilization for housing programs, how we calculate it is based off of households housed on the night of the pit. It doesn't include those that are enrolled and not yet housed. So when we're talking about the utilization, it's not truly like our effective, if it's showing that we're at 80% utilization, we could have 100% enrollment on a program, but they haven't been housed yet. Another kind of interesting factor about the housing inventory chart is how HUD looks at rapid rehousing. HUD requires that rapid rehousing be reported at 100% utilization. So you're always adjusting your beds and units to match what was actually housed on the night of the point in time count. So it's just a little bit of a wonky way that HUD is looking at it. So I'm going to go through a few of the highlights. So you can see basically what has happened with our SHS dollars, that we've had, extreme, or not extreme, but we've had rapid growth in our programs. And so that is reflective in the number of units. And when we talk about units, we mean the number of households we can serve. Units is specific to the households, and that's typically how we look at capacity. Because as you know, if we're getting you in, if you're a housing provider, you might be able to serve 20 households, but each household is going to have a different composition, number of people in it. And what we can see is that our utilization has increased from 77% last year to 90% this year. We've also seen a significant increase in the number of units. So over the last 3 years, we went from 2,269 to 3,234. And also just the number of programs providing services has increased from 76 to 87 in the last 3 years. A little bit of a view by program type. So looking just at our emergency shelter, this shows that we had 78% utilization, which was slightly down. I think part of that is because we were in the middle of ramping down a few of our shelters at the time of the point in time count. And so the utilization would have been lower because of the way that that was working. We did see that decline in shelter. So we previously had a lot more shelter, but we have been closing some of our more temporary shelters and kind of shifting our shelter capacity around. And we can also see that we have a very high percentage of beds that are serving households with children, in large part due to our family shelter providers. Rapid rehousing, like I said, utilization is 100% per HUD guidelines, but we did see a significant increase. So 2023, 2024, we had a similar number of rapid rehousing units, but in 2025, we did have some growth in the program, and we had more units of that available. Looking at supportive housing. So for supportive housing, we are talking about our HCMS program, and then any project-based PSH like Heartwood Commons or Viewfinder, and then also our Shelter Plus Care programs. And so we can see that one again. Our utilization increased, so we had a lot more households housed. And we also saw that there were some increase in capacity. So this is where the rapid growth of SHS is most visible, because we started 2023, which we are still in the middle of implementing SHS at that point. We had 1,361 units, and now in 2025, we are at 2018. But these programs, you can see there's a little bit of a difference in who utilizes those. Those are predominantly households without children. All right. And then I have just one more view to kind of bring all of this together as well. So this next view is our housing placements and capacity as of the end of our fiscal year. So hopefully everyone has seen that we publish a department-wide annual report. This is a subset of the data that's already included in that annual report to show just what our homeless services programs are serving. So I really wanted to call out, this is again kind of reiterating that capacity from the housing inventory chart. So that was the capacity in January. This is the capacity at the end of the fiscal year in June. And then also the number of people that or households that we've housed. This is households, and you can see that we've made significant progress in housing people with quite a few, well over 2,000 households housed in our homeless services programs. And that concludes everything that I had. So I don't know if we're going to have questions or anything.
I think we definitely have time for questions if anyone has one that they'd like to put into the chat section or ask. maybe Heather was just very thorough and there's no question. Thank you, Heather. That's very helpful to hear and see the data.
Thank you.
Okay, well, our next presenter is Friendly Elder House Pride Services with Alex. Alex, are you available? Are you ready?
I am, thanks.
Sure.
All right. Thanks, folks, for the opportunity to present here. It's been really interesting and informative joining this group today. So my name is Alex Maresca. I'm the Training Advocacy and Outreach Specialist for Friendly House Elder Pride Services. Kian, do you want to pop in as well?
Yes, and hello, my name is Kian Honest. I use they, he pronouns, and I am the Opal Resident Services Coordinator. So I'm also here today.
First, a little bit about our program. Elder Pride Services is a program of Friendly House, which is a nonprofit community center based in Northwest Portland. We started from the original settlement house movement. If any of you are sort of nerds like me about, that whole era. But, we're 100 years old. We've gone through changes over the years, but our commitment in general is staying focused on the needs of our community and flexibly adapting to those as they change over time. So Elder Pride Services is a program that's existed since 2001. We've had a few name changes over the years, but our focus has always been to enhance the lives of LGBTQ plus older adults through education, advocacy, and various social and community building activities around town. We primarily work in Multnomah and Washington counties today, but we also do advocacy and training work statewide, trying to raise awareness of the unique needs of LGBTQ plus older adults. So we sometimes get questions about why we specifically focus on this population and why we have for so long. So I want to talk a little bit about why this population is so underserved. First, it's really important to remember that LGBTQ plus older adults have experienced discrimination throughout their lives in a variety of areas of their lives. Discrimination in employment, for instance, has led to reduced wages and earnings over time. Discrimination in housing access has also led to a lack of accessible and financially solvent housing. As a result, as LGBTQ plus people age, they're disproportionately likely to have experienced financial instability, even though they tend to be better educated and to have worked longer than, or as long as the rest of the population. It's also worth noting that this is not just historic discrimination. Discrimination continues, as studies show, in housing, health, and other services. And so many LGBTQ plus older adults continue to experience barriers to accessing services as they become available. Another unique challenge for many older adults in the LGBTQ plus community is that they often rely on peer networks rather than family of origin networks. While this can lead to extremely resilient and strong communities, it can also pose challenges as people who are aging need to care for one another's needs, often like sort of navigating around their own challenges. And so we see this borne out again and again by data. The best data we have right now is the Goldson Institute survey that was done back in 2021. So this was a survey of LGBTQ plus older adults in Oregon, about 1,400 respondents overall. So really impressively collected data. This study found that nearly 1/3 of the LGBTQ plus older adults in Oregon who responded reported a need for housing services. And nearly 60% had experienced discrimination just in the past year due to some aspect of their identity, such as sexual orientation, gender identity, race, age, or sex. Alarmingly high 21% of those who were living in a residential setting had experienced discrimination. So this isn't just out in the world, but specifically in residential settings. And despite the obvious challenges posed by these types of discrimination, folks found that service providers weren't necessarily a place where they felt safe to disclose their identity, 19% felt uncomfortable being out in those settings. This poses particular barriers to actually getting the kind of services that are necessary for folks. If they can't share their entire situation, it's really hard to connect them to the appropriate services. So wanted to share a little bit about what we do about it, or what we try to do to support this population. And I see these various activities as falling into three sort of buckets. So first, there's direct support and services provision. That includes things like options counseling, information and referral. Here in Multnomah County, we do case management specifically for LGBTQ plus older adults. And at the Opal, which is an affordable housing building in Washington County, we have a resident services coordinator. We also do a variety of social programming to try and build community and reduce isolation and marginalization among LGBTQ plus older adults. So this includes in-person programming like coffee socials, museum visits, and affordable housing workshops, as well as sort of virtual programming like trans socials, lectures, and movie nights. In addition to that, we also do training and outreach work across the state. So that includes trainings with housing providers, medical health professionals, and students going into various fields with the goal of raising awareness of the needs of this population and making sure that they'll be able to meet them in their careers. But with that, I'd like to turn it over to Kian, who can tell you a little bit more about our work over at the Opal.
Yeah, so first I'm going to talk about what the Opal is. The Opal is an independent living apartments for LGBTQIA plus older adults with culturally specific programming and support. It is the first and only building of its kind in the state. We have 54 units. They're 1 or 2 bedrooms. 34 of those units are at 30% AMI, and we are partnered with the Housing Authority of Washington County to be able to offer that. The rest of our units are going to be at 60% AMI, and that just means that people pay 60% of what the area median or their area median income. Sorry, I'm tripping over my words. All of our units are designed as affordable housing, and many of them are ADA accessible. They are income restricted and age restricted, so we only have people that are over 55, and these people are within that 0 to 60% area median income range. So how this actually works and how this building kind of came to be is it's a collaboration between the Christ United Methodist Church, Home First Development, and Elder Pride Services. As representatives of Elder Pride Services, as a resident services coordinator, I work and provide like case management, connection to resources for all of our different units. We do a lot of events to meet needs, and we work with care teams to ensure residents feel supported and are able to make decisions with autonomy. We also manage the interest list for this building, which means that people that are interested when the interest list is open, we have lots of people that are already on the list. We end up taking in information and providing that information to our property management, which then reaches out to them as units become available. We provide a lot of social, educational, wellness, and cultural programming, which oftentimes can look like Meals on Wheels on Mondays at noon to 1. And we try to bring in outside entities to talk about what they're able to provide to our residents, just given what I'm seeing residents talking about or what they're currently stressed about monetarily. And we work to also provide these different opportunities to people outside of the Opal. We encourage LGBTQIA plus older adults in Washington County at large to participate in our programs, both at the Opal and at our Portland location. The Opal's regular programming includes conversations on aging, Meals on Wheels, which is every Monday, intergenerational lunches, which are a little bit more spread out, crafting, Tai Chi, and writing workshops. We recently did an Halloween party, which Alex was able to attend, and we had about 25 different people from different units there, which was very exciting. To find the different events that are going to be at the Opal that community can be involved in, you can go to our Friendly House EPS newsletter and find out which events at the Opal people can come and join.
Thanks, Kian. Just with the last few minutes of our time, I want to highlight a few upcoming events we have that we always are encouraging people to join us for. So first, we have our program's winter party. This is coming up faster than it seems. I can't quite believe we're already promoting a holiday party. But this is 11 to 1 at our Portland location, the Friendly House Community Center. This is an annual tradition, and I'm told there's dancing, fun, and lots of cool raffle prizes planned. But I also wanted to highlight a really exciting new event we have planned over at the Opal. We're planning an art show and open mic night. This will actually feature art, poetry, and music by Opal residents, as well as EPS participants around Oregon. So we're really excited about this event. We have a lot of really talented folks living over at the Opal. A lot of really talented and artistic folks who participate in our programs. So really encourage folks to come out if they'd like to see a little bit more about what we do. And finally, in January, we have an end-of-life resource fair that we've been planning. This will also be over at Friendly House. Now, this is created with the idea of connecting LGBTQ plus older adults with end-of-life planning resources that are culturally specific, supportive, and affirming of their identities. A lot of the folks we work with have told us in the past that they didn't necessarily feel safe being out to providers, or they had weird experiences when they mentioned their wife, for instance. So we're trying to sort of screen people and bring all of these resources into one space so that folks have access. We really encourage anyone to come, not to be morbid, but we are all going to die someday. We think these resources will be helpful to a wide variety of folks. So that's what we had prepared for today. If you're interested in connecting with us further, again, I'm Alex Maresca, she, they. I'm our training and outreach person. If you'd like to connect more specifically with the Opal, please reach out to Kian. Their email is up there, or to Echo, who handles more of our program organizing. Thank you.
Thank you, Alex and Kian. Yeah, and we do have a few moments for questions. If anyone attending in the network meeting has a question, you can put that in the comments section. Okay. All right, well, we'll move on to our public comment time. We do have an anonymous comment that I will be happy to read for us. It says, quote, rapid rehousing doesn't work. Number one, cut all the rapid rehousing programs and invest in PSH. Two, if you can't cut, make rapid rehousing programs longer. Three, cut caseloads down to a manageable term, 10 per employee. If programs are successful, people receiving these services talk to others who want the services. Thank you for our public comment. And that was the only one that we had come in today. So we are going to pivot to our general business, starting with equity, update on equity inclusion from Chenard. Are you available?
I am. Can you hear me?
Yep, we can. Thanks.
Awesome. Okay, I'm going to share my screen, hopefully. All right. and hopefully folks can see that. If not, just shout. But good morning, everyone. My name is
Bernard,
Trenard May.
I can't see the slides.
Can't?
Sorry to interrupt. Yeah.
No. That's what I wanted you to do. About now.
No, not yet.
Still nothing. Oh, here we go. Got it.
Here we go. It might have helped if I clicked the word share. That might have helped. So, so we're good. Oh, what a morning. All right. So, again, my name is Trenard May. I am the Senior Program Coordinator of Homeless Services in Washington County and the Housing Department. And wanted to do two things today. First, kind of just drop in and give you a sort of a brief update of where we are in our equity work, but also introduce our Hatfield Fellow, and she'll come on to discuss a survey that she's doing, and hopefully that some of the folks in the community can participate. Sorry. So first and foremost, our opportunity focused work, looking at equal access. We continue to work with the leaders with the other counties, Multnomah and Clackamas specifically, through our Joint Office Homeless Services. We meet regularly for collaboration, for training, for resource sharing, and also to make sure that we are taking a regionalized approach to things like training and outreach and so on. So that work continues. We have our cohort of community focus organizations. We meet bi-monthly. We're actually meeting in a couple of weeks, and this is a space where we bring community organizations together to both collaborate and provide each other with support, but also to provide updates and get feedback regarding any possible policy initiatives, changes, et cetera. So it's a space that we wanted to open up for years. We finally got it going in March, and it's been successful so far. Next is our internal access and opportunity training. This is a training that will be kicking up here in the next a month or two, where we are providing both in-person and virtual training to our staff. And then also our route training and process implementation. This is an ongoing process over the last year, which will continue with the completion of what we called the Wealth Advisor Pilot. I discussed that last time I was here. Basically, it's our way of having someone advising whenever any policy program is being looked at for revision or changes or updates, to have a racial equity lens component. And we have we have people in each branch of Homeless Services right now that are responsible for facilitating that conversation. They meet with myself, and we discuss the meetings, what went wrong, what went right, what suggestions do we have. We wanted to kind of fill in the blanks, hence the word pilot. We were working from the ground up, basically. So that's been successful so far, and we'll be completing that here within the next month or so. And then we'll be rolling out training to the full housing department on this tool, and hopefully get more advisors for the work group. So a lot of success in the implementation. We've run it now 4 times for various policies and programs, and we look forward to our future in that. Next is our access focus work. We have, looking at community fairness, we brought on a PSU Hatfield Research Fellowship, her name is Mina Kim, which she'll be coming on shortly. And we're having her investigate and identify disparities between housing needs and our solutions, looking at conducting assessments of our SHS program data, looking at Community Connect, service delivery methods, and even our providers. Our goal really is to evaluate fairness in this arena and to see when it comes to data processes, whether it be collection or evaluation. So with that said, I'll bring on Mina.
Good morning, everyone. My name is Mina Kim. I'm the Hatfield Fellow with Washington County Housing Services. And thank you for giving me a few minutes today. And as a part of my fellowship, I'm leading a project that looks at how residents experience housing and homeless services through a lens of access and fairness. So many residents experiencing housing instability hesitate to use public programs. So this study aims to understand why that happens and what can make services more welcoming and accessible. Next page. Uh, next page. So the goal of this study is to listen directly from the residents about what makes them hesitate to seek housing services. So we recruit about 20 residents through housing service partners. They will join in 4 small groups with about 5 participants each, based on the type of services they've used or are interested in using. This includes people who have received housing support and those who hesitated or decided not to apply. So each group session will take about 60 to 90 minutes, and participants will do a short activity called Q-sort, where they will rank 16 short statements about their thoughts and perceptions of housing services. Then we'll have a follow-up conversation to discuss the reasons behind their choices. Through this process, we'll explore 3 main questions. First, what makes it hard for residents to apply for the services? Second, how do language, culture, and community norms affect participation? And lastly, what would make the services more effective? And in coming weeks, I will be reaching out to you, maybe again, and our partner organizations to help connect with residents who may want to participate. This study is designed to reflect racial and cultural diversity among service users in the county. So when selecting participants, we'll consider race representation. And so far, we've had very few Asian residents register, and we especially hope to include their perspectives as well. So your help in reaching out to those communities would be greatly appreciated. Thank you again for giving me this time today, and I hope this project will help us bring residents' voice into housing policy. Thank you very much.
Thank you, Mina.
Yeah.
All right. I believe we have some time for questions. Okay, well, Mina and I we'll put our email addresses in the chat for any folks who may have some questions or want to follow up with us. Also, of course, Mina asked for your help in reaching out to this population of folks to be a part of the project as well. So we'll go ahead and do that, and I hope everyone has a good day.
Thanks, Bernard. Thanks, Mina, for sharing. Much appreciated. And now we have a brief update from our Solutions Council. Kim, Marshall, are you here?
I don't think she's here yet, but I didn't see her come online. But I can say that just a to reiterate what Katie mentioned earlier, on the 20th at about 4 is going to be the Solutions Council meeting this month. It's a little bit different than usual because usually we start at 2. The meeting will start at 4, and then we'll go into the public hearing, which is on the local implementation plan, which is something Katie mentioned earlier too. That's something that we discussed here at HSSN, and we're opening that we're opening up for feedback to the greater community as a whole, and so you can share that information with folks. It's also included in the HSSN Digest. So there's like a flyer and there's surveys that you can share with your clients or your members. And I think I posted and Katie posted in the chat some of that information as well.
Okay, great. Thank you, Nadia, for jumping on. And Mina, I don't know if you noticed, but there was a question directed to you in the comment section, if you wouldn't mind responding.
Yeah, I was writing and I can just say, and yeah, this is about the Washington County's study, but if there is no people, Asian people who participate in this study, then I can expand this to the Portland area, like, yeah, Clackamas County and Multnomah County as well.
Okay, great. Thank you, Mina. Sometimes that's quicker than having to type all that in. Just pop on and say it. So, well, much appreciated. Thank you to all of our presenters today, and thanks to all of you for the work and dedication. A few last-minute announcements. If you or your agency would be interested in offering a presentation during this meeting, the HSSN meeting, please reach out to Lindsay. Lindsay will have her email here in the chat. And then I also wanted to mention that the organization I work with, the Washington County Hope Center, has open enrollment right now for holiday presence assistance for Washington County kiddos birth through 15. We try to get them 3 or 4 presents each. And so we are doing signups right now, and people can sign up online. It's a pretty simple process. I'm going to put that is the website, saangeltree.org there. Please get that out to any individuals who have kiddos or families who have kiddos birth through 15. We'd love to assist them this holiday season. Next HSS meeting will be Wednesday, December 3rd at 8:30 a.m. Right here online. And then lastly, we'll just open up the floor. We always like to end with an opportunity to do kudos or highlights or agency events or just anything that you're excited about that we could get excited about. Here's an opportunity to share that. Otherwise, have a great day. We're getting out a little bit early so that you can go enjoy this awesome weather of wind and rain. Yeah, hope you have a good month.